Thank you for joining the Constitutional Medicine Part 3 webinar on digestive and circulatory health in the Hematogenic Constitution. My name is Heather Schofield, and I'm the Medical Director here at Biomed, and I'm really excited to be able to be hosting this webinar with Henrietta De Jong. She has over 25 years of experience in this field and is an expert in many things, including European biological medicine, homotoxicology, drainage and detoxification, iridology, sanum isopathics, psychosomatic energetics, and of course, constitutional medicine, which she's going to be sharing tonight with everybody. I am so thrilled that she's able to present part 3 of this ongoing series of constitutional medicine. And within this webinar, the focus will be on the Hematogenic Constitution, which covers off liver, digestion, and circulatory health. And so with that said, I'd like to pass things over to Henrietta. And Henrietta, thank you for being able to present this wonderful webinar.
Thank you, Heather, and again, welcome to everybody that's listening. Thank you for doing this next presentation with us. It is an absolute pleasure to work with Heather. As Heather said, she is the Medical Education Director of Biomed, and she has done this work for a long time, and she's got a lot of knowledge and experience. And in general, I have to say it's a pleasure to work with all the Biomed staff. There's a lot of people behind the scenes that you might not know, but they all do great work. They're very well educated and they provide very good service in all the departments. And the director, Gavin Ma, is a very honest and trustworthy man, which is rare in this society nowadays. Above all, he is very ethical, and that shows throughout the entire company.
Thank you for that lovely introduction of Biomed as well. And so, can you please talk about why the Constitution is important?
Why is it so important for us to understand constitutional medicine? It is to learn to support the underlying weaknesses and to prevent diseases from developing too soon. And with our genetic code, we're eventually all going to get some type of disease that we are predisposed to, and we like to halt that process for as long as we can. In your practice, you will see patients come in the preclinical stages, for instance, in the disease stages, and in advanced disease stages as well. And it's up to us to understand where each patient is at and recommend the appropriate protocols.
Now, for those that are new to constitutional medicine, can you talk about what the Constitution is?
Absolutely. The Constitution is the sum of our inborn characteristics. And of course, it determines the typical disease patterns that are expressed by us and how this disease then develops in the body. In the European model of the IRIS diagnosis, which we are basically teaching, it's founded on the principle that we are born with this set constitution, which is basically the DNA that's passed forward by our parents and grandparents. And it's a combination of our strengths and our weaknesses. And we have many factors that can influence that. That's, for instance, lifestyle. If we think about stress or working in a negative environment or lack of social activity, think about our COVID times. If we are in dysfunctional relationship, if we don't eat well, here is your nutrition that comes into play. Think about your refined sugar intake, your genetically modified food. Think about unhealthy fats intake. Well, think about lack of exercise, physical activity, or not drinking enough water. You need to have your sleep. Think about poor sleep patterns, what it can do to our health and also to our constitution in general. And then some of us have a lot of medical interventions, so a lot of medications that we have to take. And also weather and climate changes or chemical exposures, pollution, that all plays a huge role. And miasms, which are inborn weaknesses that are already present at birth.
Now, for those, again, that aren't familiar with Constitution, Can you describe why it would be important for a practitioner to use and know about constitution medicine for their patients?
Well, yes. First of all, it's quite easy to determine the constitution because we either have blue, brown, or mixed colored eyes. And as we know, we have learned the remedies with the blue is the lymph drop, the remedies with the brown is the Taraxicum, and the remedy with the mixed eye is the suya. And in general, when you put your patients on those drops, they will tell you, I don't know what it is, but I just feel better. And we keep their health on track that way and break these patterns of their disease. And we resolve those symptoms that they are starting to develop when these patterns are setting in. And so, yeah, it is very important. I know these webinars can give us a lot of information and sometimes get us into information overload, but it is very important that we start doing this in the practice. And it's simple a matter. You don't even have to have a tool for this to see if a patient has a blue or a brown or a mixed eye. And when you add those base remedies into there, you already get patients, as I said, feeling a lot better, even if they are just 6 weeks on the base remedies. And it is such an invaluable tool to have. And we will discuss further protocols a little further on in this webinar.
So with constitutional medicine, part of the solution is looking at ways to remove toxins from the body. And hemotoxicology is one of the therapies that can be used for that and also for constitutional medicine. So can you talk a little bit about hemotoxicology in framework of how it fits into the constitutional medicine modality?
Yeah, so how does that exactly relate to constitution medicine? I'd like to give an example, and I'd like to give an example of the brown-eyed hematogenic constitution. So we know in this case, the liver is one of the weak spots. So you, for instance, can have a patient come in and they start with symptoms of bloating and abdominal discomfort. The next thing you can probably see is they can experience weight gain because they retain fluid, which is the portal vein back up there. And of course, this leads to ascites, the fluid collection in the abdomen. And the abdominal pain will start. And then in the clinical picture, the doctors will see the liver enzymes start to rise in the blood work. When you look at an ultrasound, you will often see that there is a fatty liver. And then in the next stage, the scarring in the liver will occur and the white of the eyes and the skin will literally turn jaundiced, yellow, of course. And if this is untreated, your patient will end up in liver failure. Now, if we can, of course, work and reverse this liver damage by natural means, that will be absolutely preferred and ideal. But there will come a time that we do need medical intervention. And as practitioners, we have to recognize that time when that is there and refer your patient back to their physicians accordingly.
That is a great example, Henrietta. Any other things that you'd like to say about hemotoxicology before we continue on?
Well, of course, as you said, it's it's an attempt of the body to heal itself, and as it goes through these stages, it will try to eliminate toxins on its own. And often you will have symptoms when you have mucus in the bowel, you can have diarrhea, a reaction can be fever, another reaction can be vomiting. These are all signs that the body is trying naturally to excrete its own toxins. When it cannot do that anymore, it becomes a more serious situation, and then we need to treat that. And because it can lead, as we saw in the example that I tried to give, it can lead to the chronic degenerative diseases. And that's when we need to step in to try to prevent that.
All right, thank you for that. So now we're going to start talking more about the hematogenic constitution. Can you give an overview of what it is before we start moving into more details around the hematogenic constitution?
Yeah, I'd like to say that the liver is one of the most important detox organs, and because everything goes through the liver before it goes through the other detox pathways. We think about our bowel, of course, we think about our lymph, we think about our lungs, kidneys. This is all very important because that pathway needs to be open at all times, because all blood needs to be filtered through the liver, and it is the main toxic filtration system.
Now, with the liver and the biliary system, can you go into a little bit more detail about the types of things you would see clinically that could flag that this system needs some extra support?
Absolutely. One of the first things I often see in my patients, they will come to me and they say, Henrietta, I wake up every night and I'm just drenched in sweat. Are these hot flashes? But no, they are not. They are actually night sweats caused by the liver, because the liver is very active when we sleep at night, especially during the hours from 3 to 4. Another interesting symptom that you can actually see developing is the numbness from extremities. Patients often say, well, my feet are numb and my fingers are starting to be numb. Think about the liver when they tell you that. And when they say, I can't concentrate, I feel like I'm confused, and they feel like they're getting dementia, and that is not what it is. It's because the liver is so terribly toxic, they can't think straight. They will be very restless. They will complain about burning or sweaty feet. And of course, the skin conditions that we can see in various cases of when you have acne, rosacea, or they're blotchy, or in case of yeast that cannot be detoxified, you'll have all kinds of rashes. Bad breath is very much a sign of a liver condition. Burping, of course, bloating, trouble with digesting the fatty foods, chemical sensitivities. Of course, they get, the patients can get very angry, irritable, very frustrated, and very resentful. The frustration often refers to the liver, and resentful refers to the gallbladder. And on a second note, for those of you that do RubyMed, I just like to add in here for a minute, when you use your RubyMed device or you do your RubyMed remedies, that we often see any of these signs and symptoms when your patient is in chakras 3 with a corresponding MVita, I believe it's 8 to 11, and you'll see often this irritability, this anger, this frustration, this being resentful, being very fed up, moodiness. And often when you do the RubyMed remedies, a lot of these symptoms start to go away. They start to disappear, and your patient feels much better.
Now, the liver has many functions and very important functions. And so can you do an overview of what those functions are?
Absolutely. Of course, the bile production, it breaks down the fats in the small intestine during digestion. You will often see that if the bile is not getting into the small intestine, that your patients will have problems with absorption. The cholesterol production is important because the cholesterol helps to carry the fats throughout our body. Another very important function of the liver is the glucose glycogen conversion. So when there is too much sugar glucose, it will be converted into the glycogen and it will be stored. The liver will make actually glucose as needed to balance the blood sugar at any time in the body. But if the body needs energy, it will just convert that glycogen right back to glucose. It's a wonderful function. And also think about this, supporting the liver when your patients have diabetes, always. Another important function is the processing of hemoglobin for the use of its iron content. Another disease that comes to mind is hemochromatosis. Often the liver is not functioning proper in this disease when there is too much iron. Now, when it comes to circulation, the liver clears the blood of its toxic substances and regulates the blood clotting. Now, another very interesting function of the liver is the regulation of sex hormones, thyroid hormones, and adrenal hormones. So when you're treating your patients for these conditions, always support the liver. And of course, one of the most important function of the liver is to activate our digestive enzymes.
Now, with that really great overview of the functions of the liver, let's start moving into the hematogenic therapies. And so if someone's going to be working with constitutional medicine, we reviewed the lymphatic constitution and the therapy goals in the previous presentation. And so for those brown-eyed folk, what are the goals with the hematogenic therapy for this group of people?
We want a good bile flow, a good bile production, which when that flow is good, it stimulates our intestinal peristalsis. And of course, we get rid of the gut in the gallbladder and any gallstones. And of course, we detox very well that way. The fat metabolism is important because we need to decrease cholesterol and triglycerides, especially in the blood values. We need to see this. And of course, here is where diet is very important as well. We want to improve the fat digestion so that we prevent getting fatty livers. We want the blood flow to the liver to be very much stimulated for the liver regeneration. We want to, again, eliminate the toxic load. We want to reduce portal vein congestion and improve the vascular and venous circulation that way. Therefore, then we decrease the tendency of the varicose veins, your hemorrhoids, even anal fissures, your blood clots, and then of course, very important, we want better digestion. So therefore, we won't get constipated and we will not have the overgrowth of bad bacteria as in dysbiosis.
Okay, so the hematogenic constitution is what is the focus tonight. Can you just do a nice overview of the 3 different constitutional types so we can put it into a little bit of framework here?
Yes, we go back to our famous chart here. Of course, we have the lymphatic type, which is the blue eye. And of course, for the Sanum users among us, we can also call this the penicillium constitution, where a lot of infections take place because the lymph can be weak. Always we use lymphodrop for that. We have as we're talking today about the hematogenic type, the brown-eyed, and for Sanum users, again, it's the mucor type constitution. And we'll be going into these 2 different subtypes that you see under there. We'll talk about the GI constitution there, which is the brown ring around the pupil. We'll talk about the pigmentation spots. But of course, our remedy to use is Taraxicum, which we will get into details. And now, not to forget about the dyscratic constitutional type, which is the mixed colored eye or the aspergillus type. And for that constitution, we use Thuya.
All right, which is the next presentation. So definitely join us in June for that one. Okay, so now with the Hematic Constitution, there are many indicators and characteristics. So can you describe what those types of indicators are?
The number 1, of course, is the brown eye color. And I have to say that can come in very different variations. You see a lot of dark brown eyes, but you see also a mixture of lighter brown and darker brown, and sometimes just lighter brown. The complexion of your patients often is dark, and they will have black or brown hair. when you look at their structure, their physical structure, they're often short and stocky. They're very strong in muscles. They also can be soft and round, and they're often big eaters, but they do not tolerate their food very well and often develop food sensitivities and allergies. So typical disease manifestations that we can find in the hematogenic constitution are the dysbiosis, as we talked about, the gas, the bloating, gastritis. We can have IBS, we can have chronic pain, we can have liver and gallbladder issues, as in fatty liver and gallstones. We can have migraines due to a very toxic liver or due to gallbladder attacks. We can have a very slow metabolism. We can have congestion of the circulatory system. So when the portal vein backs up, your whole circulation system usually gets into trouble. We're looking at that ascites, where the fluid collects in the abdomen. And then we can develop of blood clots and the varicose veins again. And then all the skin issues that come up with the liver congestion. So again, we talk about the weakness in the hematogenic constitution is the digestion and the circulation and the liver.
All right. Now, you alluded to the fact that there are some subtypes under the hematogenic constitution. And so can you give us an overview of those two types, and then we'll do a little bit of a deeper dive into specifics on the gastrointestinal type and the pancreas type?
Absolutely. The gastrointestinal type, you will see a brown ring around the pupil. We actually call both of these type iridology, specific iridology signs. So you can see the gastrointestinal type also with blue eyes and with mixed eyes. I'd like to talk about it with the hematogenic constitution because these always refer to GI diseases. So when you see this brown ring, just think about your people with Crohn's and ulcerative colitis, which we'll get into a little bit later. And then the other one that you see at the bottom there, and you see that's more with the blue eyes, and that is the pancreas type. And you'll see a lot of pigmentation spots in there, especially the bottom half of the eye. And these people often have problem with pancreatitis, and most often they get diabetes.
So I know you just talked about both of the subtypes. And so this is the GI signs subtype for the hematogenic constitution. So can you detail this one a little bit more?
Absolutely. Think about your inflammatory bowel conditions, your IBS and your Crohn's. When you think about IBS and Crohn's, the interesting thing is that IBS mostly it takes place in the large intestine, while Crohn's can actually take place from basically the mouth to the rectum. And IBS, you will find solid disease through the entire bowel, while with Crohn's you can have actually healthy spots in between. We'll talk about it a little bit later. That's more colitis and Crohn's that I'm comparing. IBS is basically the forerunner for Crohn's and colitis. So colitis more in the large intestine. And again, that usually the whole large intestine is diseased. There is no healthy spots in between. Now, diverticulitis is, of course, the pouches that can develop and the stool can basically get stuck in there, and then we get that inflamed. Here we have the next slide up, I see, which I was trying to discuss here. Again, mostly seen the Crohn's here is mostly seen in the small and the large intestine, while the ulcerative colitis is mainly the large intestine with no healthy areas. And Crohn's, you can also see ulcers on the gums, inside the gums or the lower lips, even under the tongue. And there is some parts that can actually, when physicians do the colonoscopy, they often see parts completely healthy, and then after that you have a big part that is diseased again. So when we look at this here, the signs and symptoms of Crohn's and colitis are very, very similar. There is lots of cramps and a lot of pain. There is diarrhea, or at times even constipation, mostly diarrhea though. People have an urgent need to constantly have bowel movements, or they feel they cannot empty out properly. A lot of rectal bleeding and mucus in the bowel as well. Their appetite is not good. They eventually start to lose a lot of weight. They develop fever when the inflammation increases. And of course, they're extremely fatigued. Now, as I said, the IBS, which is of course a medical irritable bowel syndrome, it's a name for a collection of symptoms. And these symptoms are not as severe as Crohn's and colitis, but eventually, if it's not treated, I find these patients that turns into Crohn's or ulcerative colitis.
Okay, now with the other subtype, the pancreatic subtype, can you talk about this a little bit more detail?
Yes, so we see these pigmentations here, as I said, mostly in the bottom half of the iris. You will find that those pigmentations can be of a variance of brown and orangey colors. And also we often see in those large lagunas, which it's almost like a little opening, as you can see in that eye, and these pigmentation spots are within those openings. So, you know, it is important to know that often these patients are predisposed to the diabetes for sure, and you often see them with pancreatitis or other conditions of the pancreas. And of course, the remedies that we like to use, first of all, Traxicum, and in the case of diabetes, you add Rubus to it, or other GI formulas, as we're going to talk about a little bit further on.
All right. Now, Henrietta, you have alluded to Taraxacum a few times throughout the presentation, and so now is the time that we get to start sharing this. And so with Taraxacum being the foundational remedy for the Hematogenic Constitution, can you please share some more information about it?
Taraxicum is a very powerful remedy. It strengthens the liver, the gallbladder, overall digestion, and the circulation. And how it does that is it improves that bile production and flow that we need so badly. It will aid in a better digestion. It will reduce the portal vein congestion. It will strengthen the function of the liver and the gallbladder. And it will rebalance any intestinal dysbiosis and overgrowth of microbes. Now, specific conditions that we use this in is liver enlargement, pain, jaundice, cirrhosis, fatty liver, gallbladder, gallstones, gallbladder attacks, portal vein congestion or pain. And here come the skin conditions, which often are very itchy. And then, of course, the venous swelling and congestion, the varicose veins for the vascular aspect of this. But I've also seen that this can heal wounds and reduce redness and bruising and swelling. Also with sports injuries, it comes into play. The digestive tract here, of course, the constipation, it has a laxative effect, increase the peristalsis, so better bowel movements, less pain, less bloating, less dysbiosis, and then also talk about those migraines that are liver related because of the gallbladder. It also has a good control over that. Now, the recommended dosages for adults, 5 to 10 drops, 2 to 3 times daily. We can also go a bit higher if needed. But keep in mind, you're sensitive people, you're sensitive patients. This is a strong formula, so you need to use a little less. And then the children, of course, we need to stick to a lower dose. The the little guys, only a couple drops 2 to 3 times a day, and then the 4 to 10 years old can use 2 to 3 times daily.
Great, thank you for all that information on Taraxacum, Henrietta. Now, there are some other liver gallbladder remedies that may be relevant in certain types of circumstances. And so can you talk a little bit about differentiating the different types of liver gallbladder remedies that could be used either with Taraxacum as the core remedy or maybe instead of, depending on the situation?
Absolutely. You're right in saying the Taraxicum is always the core remedy, and then we look for the good combination according to the signs and symptoms, or if you have a device, according to what you're testing. So A. hepatica, I like to use when there is poor absorption. So that one also is very good in any inflammatory conditions like your gastritis for sure. I have used it in Crohn's and colitis as well. For patients that cannot digest and just tell you, oh, I just feel so uncomfortable, don't hesitate to use this remedy. It's a very good remedy, and it combines very well with Taraxicum. Now, the Cardis I always use for gallbladder issues and constipation issues because it cleans out the gravel, the sludge, small gallstones it can get rid of. It helps with digestion of fat, which of course is a problem in the gallbladder conditions. And again, it detoxes it. And so that I always use for gallbladder issues. The Cardinera is a lovely remedy which is very successful in lowering blood cholesterol levels. I use it in many cases. I take patients off their statins, which is your Crestor and your Lipitor. And of course, that has to be monitored in conjunction with a physician, and your patient will have to go for frequent blood work at least every 3 months to see if this is working. But I've seen it work extremely well. Within even 6 weeks, your levels will go down of your cholesterol, and they will not have to suffer those side effects from your statin drugs, which can lead to severe muscle pains and joint aches and issues there. So it helps also with the patients that have difficulty swallowing, again, in a feeling of fullness, GERDs. They are a bit interchangeable, and yet they are very different, these 3 remedies.
That was a really nice overview of these first 3. And I also wanted to just add with Cardinera that I've had a lot of very successful cases in helping patients get their cholesterol levels back into a normal range by using Cardinera and really focusing on the liver. And so they didn't have to go down the route of any more pharmaceutical type remedies at that time. So yeah, Cardinera, as far as working with cholesterol, it's a really lovely remedy to do so. And so next, we've got, so all of those remedies that, Henrietta, that you just detailed, so the Taraxacum, the A. hepatica, the Cardis, and the Cardinera are all in liquid form. So we now have 2 that are in a capsule and in a tablet. And so can you talk about Taraxa and Heparplex?
Yeah, of course. The Taraxa, when I look at a patient coming into my office, for instance, and they present with severe digestive symptoms, where you know that their symptoms are advancing into disease, I always start with Taraxa. I honestly put them on a 10 to 14-day liver detox, as it says there on the slide here, and they need to get these toxins out. So we need to just give them a little more than just the homeopathic remedies that we just discussed, and put that Taraxacum in the protocol as well. And after that is done, then I switch them over to Heparplex, because that remedy is very good for the liver function, and it also repairs liver damage and it regenerates it. So use the one first and then switch over to the other one, especially in very severe toxic cases.
All right. Now, just before we dive into the protocols, Henrietta, can you do just a quick overview of the Hematogenic Constitution, of course with the idea that Taraxacum is going to continue to be that foundational remedy within this constitution for the brown-eyed folk?
Absolutely. Just think about your conditions that are very clear. It's always the liver, the gallbladder, and mostly as a result, the skin. So we have issues with the digestive system in general. We have issues with circulation and with the vascular system. So these conditions that come into play, as we discussed, are gastritis, IBS, chronic pain issues, bloating, gas, weight gain because of it. Again, dysbiosis, fatty liver, gallstones, gallbladder attacks, constipation, itchiness, skin eczemas relating to liver congestion. And then, of course, the circulation, as in, it starts often with the portal vein congestion, which then turns into more circulatory conditions, as in varicose veins, hemorrhoids, and a lot of blood clots.
Okay, so with that review then, we're going to move into building protocols or having protocols that have been built and reviewing them. So we're going to look at just the overview of liver, gallbladder, bile, and digestion. So Henrietta is going to go through those 6 liver remedies again, and they'll all be on one page, and so there will be some differentiating on how to choose them and when to choose them. And then talking about bile production, Crohn's, colitis, and IBS, how to lower cholesterol, fatty liver, itchy skin, and finally how to relieve vascular congestion and the conditions, some of the conditions that can be associated with those. Okay, so first and foremost, we have got the 6 liver, gallbladder, and 5 liver gallbladder remedies, and then 1 stomach remedy that's also important. And then we've got Taraxicum as the foundational remedy. So in the end, it's true. We have 6 liver gallbladder remedies and 1 stomach remedy. With that, Henrietta, can you go through and just talk about these remedies one more time, just so we can get some nice clarification about when and where we should be using these different types of remedies?
Absolutely, Heather. Of course, again, as you said, we start with our core remedy, which is Taraxicum. We combine it if there is a lot of inflammation or indigestion with a hepatica. If your patients cannot absorb, it often results in this bloating issue because they can't absorb their food properly. I put Taraxicum in a hepatica. Then we think about our gallbladder, our bile flow, our constipation, cholecystasis, the stones, the attacks. Then we start with Taraxacum and we combine it with Cardis. Cardis, very successful remedy, especially in relieving constipation, increasing that bile flow and less gallbladder symptoms. The next one is our Cardinera, as we said, very successful in lowering cholesterol. Often patients will get off their remedies or they don't need their statin remedies. Interesting remedy that I find is Obstintium, which is a remedy that I often use in patients, especially kids that have failure to thrive. They don't have an appetite, they don't want to eat. They're very picky eaters. They often have developed parasites. And if you give them Obstintium, they become a different child. It's very effective, even in heartburn and digestive issues. It's effective on its own, and it's effective with Taraxicum as well. Taraxacum can be combined with the two supplements. Taraxa, we said, for a 10-day detox, and with the Heproflex, again, for liver support, for repair, and for improvement of the function of the liver.
Perfect. Thank you for that, Henrietta. Okay, now bile production, including insufficient bile production and gallstones, gravel, and sludge. Can you talk about the remedies that will be helpful in helping with these types of situations?
Absolutely. We again go to the Taraxicum and combine it with Cardus, because if our bile flow and bile production is insufficient, we will develop the gallbladder conditions, the constipation issues. And so we dose the Cardus quite high in that case. 35 drops 2 to 3 times a day is not unusual at all, but think about your sensitive patients again. They cannot handle the big doses. They get major detox reactions in that case. Again, the A hepatica with the core remedy of Taraxicum is stimulating the bile flow as well, but again, decreases inflammation, decreases spasms, makes sure that we get all our digestive secretions. And that is very important in the digestion to get our enzymes going. And we can also have the Cardus, as we said, it will dissolve the sludge for sure, and it will dissolve the gravel and the small gallstones. And with the symptoms that you're typically getting when there is not enough bile production is you get very smelly gas, and boy, is it smelly, they know. Diarrhea, we will have the pale colored stools, we will have erratic bowel movements, we will have a lot of stomach cramps, and often patients suffer from weight loss.
All right. You did a beautiful job talking about Crohn's, colitis, and irritable bowel syndrome. And so can you now cover off on the types of remedies, and as far as a protocol, the things that could be able to help with these types of inflammatory bowel conditions?
Yes, in case of Crohn's and ulcerative colitis especially, I will always start to reestablish the gut with the Peyer's patch, the Pleoribosan, very effective. I would do 1 capsule 2 to 3 times daily, and I have this remedy going for a week or 2 just to reestablish that digestion, so the patients actually can start the work in their gut again. The only thing you might have to watch out for if they are sensitive to pork. We can also put the GI formula in there, 1 capsule with food 2 to 3 times a day, which is a very soothing remedy for the gut. And of course, not to forget, we do probiotics, probiotic 7-in-1 or the Bacillus coagulans. And we need 1 capsule with food 2 to 3 times daily as well. For drainage, I would really like to add the lymphodrop in this protocol because they need to drain, and it's very important. Think about all that lymphoid tissue that is present in the gut and in our Peyer's patches for the nutrients and toxic exchanges there. Is very important to add lymphodrop. Or we can also do Thuya. That is also for the mixed constitution, but I also use it for drainage. It works for that as well. Another thing that you could consider is the Restorative Intestinal Kit that Biomed carries, which is an excellent kit. And of course, we can't forget about the diet, very important.
Yeah, definitely in these types of conditions, the diet to give the gut a break so it can heal, and what you're giving it through supplementation can do the job it needs to without having food constantly interrupting and inflaming more. Okay, so now let's move over to cholesterol. And I know you have already done a beautiful detailing of Cardinera. And so with cholesterol and lowering cholesterol, can you talk about some tips and techniques on how to do that?
Yeah, you have to first of all look at your symptoms. We actually have cases that we have too low of a cholesterol, and what you see in your patient there is that affects the mental states. They find they're nervous, they're confused, they're agitated, they're restless. They cannot make decisions. They have very poor sleeping patterns. They just are not right. In that case, I would definitely put them on Heparplex to repair the normal liver function. 1 capsule twice a day is perfect. And of course, now, what are the cholesterol symptoms when it's too high? The very heart-related symptoms, you'll find that patients can have angina, chest pains, they can be short of breath, they can have actually pain in the neck, the jaw, upper abdomen, in between their shoulder blades. And again, they can have that numbness of the extremities. And then again, we put them on the Cardinera to lower that cholesterol. I see that you've added some things which are very important there, Heather, about the Cardinera. It's a natural lipid blocker, basically. And of course, it reduces the cholesterol and the triglycerides, as we stated previously. But for the support, we can use BioC, which also reduces inflammation, or BioBoost. For that stress that we were describing, we can use the Avena Sativa, because that reduces stress levels from Nesman, what you carry. And it helps, of course, to level out the nervous system. If necessary, you can put them on some Enxivida as well.
Yes, that's a really good tip as well. Okay, continuing to talk about fat levels, let's talk about fatty liver now.
Well, the symptoms of fatty liver, sometimes it's hard with all these conditions to keep the symptoms apart. One of the symptoms of fatty liver is definitely nausea. They will be extremely tired. You will see elevated liver enzymes in the blood work. You will have people with abdominal pain, and they will be full after they eat. They will often complain of that pain in the right side, and they will often develop yellow skin and the yellow in the whites of the eyes. So again, we use Taraxacum first of all, but we detox with Taraxa. Again, that 10-day detox that you do, and then we can also use, which is a very good remedy for the fat metabolism, it's called tocopherol. That is important to heal a fatty liver. And lipidzyme, which is a digestive enzyme that Biomed carry, which is very focused on fat, breaking down the fat, which is also very important.
And with tocopherol, with the tocotrienol component of tocopherol, the Evanol Superbio company that produces the tocotrienols, they've actually done some studies in humans on non-alcoholic fatty liver disease and have some really wonderful results showing how it can help do some reversing and healing the liver. And so this is definitely something with anybody with a fatty liver, tocopherol or the biotrienol remedy to add in to the deeper foundational work of working on the actual liver. Okay, so now we're going to shift away from the liver and bile in the gallbladder, and we're going to talk about the skin next.
Okay, I would say, of course, we start using our foundational remedy again. Now, also, what is very important when we see these eczema patches of red everywhere, they can be pinprick, they can be little open sores, they can be blisters. Think about your Candida overgrowth. I find that the Pleopeth drops or ointment that goes very well together with the Pleosan staff, or you can use Pleo-Elp with the Pleosan staff, because what happens when they scratch that skin, the staph that lives as a bacteria that lives on our skin infects those little patches and it becomes very sore for them. So that combination is either Pleo-Elp or Pleopeth with Pleosan staff works extremely well. And of course, don't forget your probiotics in this case again. And then Heather, I would like you to speak about this Luvos powder for a minute. I'm just starting to work with that.
Yes, absolutely. I'd be happy to talk about it. So Luvos powder is a mineral earth powder that's mined from glacial deposits in Europe. And one of the things that makes Luvos powder very strong as a topical remedy is the fact that it's got a large size, so it's very porous. And so it has the ability to soak up a lot of toxins and exudates and that type of thing. And so with the Luvos powder then, you would make it into a paste. So you would just mix the powder with a little bit of water and mix it into a paste. And then you can apply that topically onto any skin rashes or skin irritations. And what that does is once you've applied it on, you allow it to dry, to air dry. And in that process, what's happening is it's helping to, because it's kind of drying and tightening the skin, it's helping to draw more blood flow to that area. And then in addition, it's absorbing any sorts of toxins that are topically on the skin or on the rash and or the skin irritation. So it's working kind of in two ways. It's bringing more blood flow to the area, and then it's absorbing the toxins that are available to be absorbed. And it's also alkaline in nature, so it has a change in pH in the localized area as well. And so when we're dealing with skin irritations, especially if the skin is involved with being part of that detoxing process, then using Luvos topically can be really helpful in helping to absorb up some of those toxins. So once that Luvos powder has dried on the skin, then you would just wash it off with some water or rinse it off with warm water, and then you're finished. It's a little bit like bentonite clay or doing a clay bath. In Europe, Luvos is used. It's actually the #1 topical acne treatment, over-the-counter acne treatment, and it's just made as a paste and just placed on the face to help soak up the toxins that can be involved with acne breakouts. And so that it would be how to use Luvos powder, and it would be very relevant in the Hematogenic Constitution, because that itchy skin is indicating that the liver needs some additional attention and that the skin may be trying to take over as a detox pathway. And so you're going to be supporting the skin while you're working at the deeper underlying issue of getting that liver and the bile flowing better. And so, Henrietta, I will pass that back over to you.
Okay. We got the next slide
okay,
up.
So next slide here. Okay, so then our last slide that is going to be discussed tonight is the congestion portion, or the vascular congestion portion of the Hematogenic Constitution. And so here's some recommendations which are pretty similar for portal vein congestion, anal fissures, hemorrhoids, and varicose veins. And so I will pass this now over to Henrietta to talk about a little bit more.
Sure. So again, when we have issues with vascular congestion, what we see is often hemorrhoids and often varicose veins, also anal fissures, and this is mostly due to the portal vein congestion as the fluid backs up into our system. Again, the core remedy is Taraxicum. Again, Cardis will help with the portal vein congestion, but another very important remedy is Aesculus, which reduces this venous congestion and which lessens those varicose veins and those hemorrhoids, and is very successful also for cold feet, cold extremities. Now, so we want to improve that venous circulation, and we want to prevent the blood clots, and we want the varicose veins to improve. So by using these two remedies, you'll find you will be very successful in that. Again, Aesculus I use it all the time. I find it very successful, fairly high doses. Again, even, I use it up to 40 drops twice a day. And patients feel usually improvements quite rapidly.
All right. So with that said, we have come to the end of the presentation on the Hematogenic Constitution. And I would invite everyone, if you have any questions, please type them into either the chat room or the Q&A section. And we can, I'll read those out loud to Henrietta, and she'll be able to answer them for you. In the meantime, while we're waiting to see about some questions, Henrietta, thank you for going through and discussing this part 3 of the Constitutional Medicine series on the Hematogenic Constitution. And as we discussed earlier, the liver is so vitally important to making sure that the body stays really healthy for everyone, but also including those that are genetically weaker towards that as well.
It's an absolute pleasure to do this, Heather, with you.
Okay, so we've got a couple of questions in here. So Pamela asks about, does liver detoxing reduce cholesterol crystals in the blood? And so I'm not sure if she's referring to using live blood in dark field. And Henrietta, do you have any experience or are able to comment on this?
I'm not quite sure about this one, Heather, to be honest with you.
Okay. I think that from what I understand, if you're doing live blood or dark field, you can see cholesterol crystals that show up on the slides. And from what I understand, working on the liver and liver detoxing can help to reduce that presentation. So I think the answer is probably yes, but to
I would
clarify,
think so, yes.
Yeah. We can get clarification if we have any dark field people on here. So, okay, now we've got a few other things showing up here. And, oh yes, can you talk? Oh, okay, so we have somebody who'd like to see the fatty liver and fat metabolism slide. Okay, great, I can show that again, no problem. And okay, so I've popped that one up. And so we've got somebody else mentioning about Raynaud's. Is there any recommendations you would make to help somebody out with Raynaud's?
That would be Aesculus. That works very well for that.
Okay. So the remedy Aesculus, which is what was mentioned in that vascular congestion slide, would be helpful then. And of course, because that gets the circulation flowing, the peripheral circulation flowing. All right. The chat room is a little bit quiet tonight. There is, oh yeah, okay, so Pamela did confirm it is in for live blood in dark field. And so from what I understand, going back to that cholesterol crystal question, that from my limited experience with live blood in dark field, I believe that when you move in and start doing that liver detoxing, especially using Cardinera, you can get that presentation to change, and no longer will those cholesterol crystals show up in the blood.
Okay, that makes sense.
Now, this is a very good question from Cynthia. What if you no longer have a gallbladder?
Then the liver needs all the extra support you can get it, right? Because it's supposed to take over the function of the gallbladder. And, you know, I would look at using a hepatica, especially in that case, because that helps that as well as the lipid zyme, because we need to be able to break that fat down, and the gallbladder is not there, it becomes a problem. So yeah, I would suggest for that one definitely a hepatica. And of course,
Okay,
Hepaplex will work. Yeah, Hepaplex will work in that instance too.
Mm-hmm. Yes, and you can technically even use Cardis. I know that it's talked about like a gallbladder remedy, but it's still a liver remedy as well, and mostly it gets the bile moving. From what I understand from Dr. Klinghardt, we've got 40 miles of bile ducts in our liver and our biliary system. And so getting bile moving isn't just about getting bile moving out of the actual gallbladder. Getting bile moving is through the biliary tree. And so in this case, from what I understand with all the biomed remedies as far as the liver, gallbladder remedies, they're all very relevant. If somebody also does not have a gallbladder, because they're supporting the liver as well and or getting the bile flowing and moving. And that is your number one thing you want to do when you're doing a detox, is get the bile moving, because that's what's going to get things uncongested and get the toxins out of the actual liver and moving forward. Okay, now let's see if there's any more questions here. Okay. Oh, yeah, we've got a few more here. So, okay. Oh, diverticulitis. So there is a question for diverticulitis, what to use, and would be addressing the liver the first step.
Can you repeat that for a minute, Heather? What to use for diverticulitis, and can you, what was the last one?
Should the liver be the first step? Or is there other things you would also use with diverticulitis?
I think your liver should always be the first step. And again, because diverticulitis is an inflammatory condition often, I would definitely make sure that you use that A hepatica again, and also make sure that your patient has decent fiber to get the bowels going.
Mm-hmm. Decent fiber, but not the tiny seeds.
No, not those.
Yeah. Mm-hmm. Okay. And I know, Henrietta, you talked actually about diverticulitis when we talked about this last week as well, and how it can be very related with working on the same type of protocol that you would be using for Crohn's and colitis and irritable bowel syndrome as well.
Yes, you can use all these protocols.
Mm-hmm. A few more questions here. Yellow palms on the hands, could that be a sign of needing a liver detox?
Yes, absolutely. That is a perfect sign of needing a liver detox. I've often seen that. Yeah.
All right. And okay, so in the chat here, let me just see. I thought there was one more thing that came through. Okay. So I have a question about the vascular congestion. So in here, you talk about the Taraxicum for your base remedy, and then using things to get the portal vein congestion or venous circulation moving, in addition to using something like Taraxacum plus Cardis and Aesculus. Would there be any other types of nutritionals or supplements that you would use to support that in reducing that congestion?
I can't think of any of heart that you have. Can you, Heather?
Potentially nattokinase.
Yeah, nattokinase.
Yeah, nattokinase, because it works at breaking up the fibrin. And while it's not a blood thinner, it can definitely help if there's a lot of congestion happening in the blood. In the Mucor Constitution, which of course is a little bit outside of this presentation, there's some congestion that can go with that. So pleomuc drops or pleomuc eye drops can sometimes be helpful as well.
Yeah.
But I think that this is a good base recommendation. Okay, and it looks like we've got one more question here, and just close this up so I can see here. Okay, so actually this is a very good question. So for the types of protocols, Henrietta, that are outlined here, what's the length of time somebody should be on these remedies? And would one round of a protocol be enough, or should there be consideration of doing the remedies for longer than one round?
It depends on the signs and symptoms and the severity. In cases of Crohn's and colitis, I would definitely do several rounds of these protocols, and they need to stay on the Taraxacum for a long time, because you don't solve that just in a little bit. And when you have your patients come back and do a recheck on them to see how they are doing, I would definitely, if those symptoms are not lessening fast enough, I would definitely do, in those cases, 2 or 3 rounds, if not more. It is very hard to answer this question because it depends on the patient, but do not be afraid to use these remedies for a long period, because it's not going to harm them.
Mm-hmm. That's a good recommendation, Henrietta. It's all very individual and case by case. However, the one thing as far as kind of a homotoxicology, drainage, and detox recommendation goes, usually it's about 3 months, because it takes time for the body to heal and for the cells and to replicate and regenerate and turn over. So I know a lot of the European recommendations from like Nesman Pharma and drainage and detoxification type stuff is 3 months can be a good goalpost to reach to.
Or even more. Like your Taraxicum, your support remedy like Taraxicum, you can use almost indefinitely, but you may have to make sure that you give them breaks, or I call it holidays. They get holidays from their remedies.
Mm-hmm. Okay, we've got one final question here. So you were talking about Taraxacum being the core remedy, and then adding other liver remedies maybe on top of that. Would you use Taraxacum first and finish maybe a bottle of that and then add a different liver remedy, or would you be stacking them on top of each other?
In cases of people just having some signs and symptoms that are not severe, your Taraxacum is enough, because it will just stabilize that. But in cases of more severe conditions, you need to, sometimes I start them on like 4 to 6 weeks of just Taraxacum and then slowly add the others in, because for some people, it's too much for the body to do it all together. Again, depending on the patient that sits in front of you. But for some patients, Taraxacum itself is more than enough, and within 6 weeks, they get rid of the symptoms.
Which is amazing. Absolutely amazing. So, all right. I think that we have come to the end of the questions that I found here. And let me just check that chat room anymore. Great, we're good. So what I want to do is thank everybody for joining us on the Hematogenic Constitutional webinar as part 3 of the Constitutional Medicine webinar series. Henrietta, also thank you very much for once again sharing your knowledge and your wisdom with everybody and talking about this portion of constitutional medicine. The liver is so important, and knowing which liver remedies to choose are also very important to being able to help our patients. So with that said, thank you so much for joining us, and thank you, Henrietta, and I wish everyone a really wonderful evening.